Well, hundreds of thousands of medical patients in California still do not have health care. They did their part, they applied for coverage, and the law says the state has to get them health coverage in 45 days.
But it's now gone beyond 90 days and there's still no coverage. Now they've gone to court. So what's the problem this time? As Steve Bosch reports, it's deja vu all over again. Steve?
Yeah, this has been a recurring problem ever since the state rolled out its health exchange called Covered California. And the response to what's the problem has always been and is, we're working to get better. Once again, we're told the problem in part is computer related. But the fundamental problem is Medi-Cal has been greatly expanded, but the resources to handle these new patients has not.
They're under pressure from the media, they're under pressure from the public. There's now a lawsuit about this delayed enrollment, and the state is making efforts to catch up.
The County Medical Society's Dr. Ted Mazur says the state knew it would get at least 1 million new enrollees, but its focus was solely on getting people into the system without sufficiently explaining how that's done.
If you don't think you have the resources, including the hardware and the software, to move forward, why were we so gung-ho about being the first state to say, we're going to expand, we're going to bring everybody in?
The application process is where it gets gummed up.
I've had clients trying to get on Medi-Cal for 3-4 months.
Insurance broker Craig Gusson says it's all about the state bureaucracy.
They just need to get a process quicker, and of course we're dealing with the state, so you're going to have more bureaucracy than, just having the insurance companies handle it.
The state dropped the ball. The counties didn't have the resources. The state allocated very insufficient resources, as it has always done in the Medi-Cal program, whether it's for the administrative side, like enrolling people, or the provision of services for hospitals and doctors.
So what do all those Medi-Cal beneficiaries do when they need health care?
There's no easy answer, and unfortunately what it means is people don't go and get care, or they do what they've always done. They go to the emergency room at the most expensive point of access. The emergency room has to see them without payment up front, and then later on maybe the emergency room will get paid,
but at a rate that will be subsidized by the taxpayers. Assuming all of this gets worked out, there is still a problem with Medi-Cal patients actually getting access to care.
On the Medi-Cal program, yes. We still have not done anything to improve access to Medi-Cal. Before the expansion, it was bad. With the expansion, it certainly hasn't been any better.
So they need to fix this pretty soon. Another enrollment period is less than 2 months away, and many new enrollees are going to be dumped into Medi-Cal.
So this whole issue of access, especially for people in rural communities, is really a problem.
Yeah, that's where the big problem lies, because many of the doctors in those areas don't take Medicare patients because they get paid less than what it costs them to provide the treatment, and many of them are specialties. Dr. Mazur himself has patients who come in from 30 miles away.
Mm-hmm. And we're seeing more and more doctors not accepting Medicare.
Yes,
Medi-Cal.
we are.
Yeah. All right. Thank you, Steve.